Biotech company Cessatech, specialized on medical treatment for children, are presenting their secondary offering. And to do this, I have on link their CEO, Jes Trygved. Hello, Jes.
Thank you, Matthias. Hello.
Hello. Could you please just tell us a bit about Cessatech and your products?
Yeah, we're a small biotech company founded a few years ago, really from the need of the main hospital in Copenhagen, actually also in collaboration with Karolinska Institute in Stockholm, where they had an unmet need for giving pain management to children, especially smaller children. And that's how the company started, out of a university spin-off project. And I'm proud to say that we are now very active with the clinical development and will hopefully end it already by next year.
All right, and you have CT001 that is soon to be on the market?
Yeah, well, it's anyway soon to be done in terms of the clinical program. So CT001 is a nasal spray for acute pain treatment in children from the age of 1 to 17. And we are developing this with 4 clinical trials where we are just in the middle of the very important one, what we call the pivotal trial. And that is hopefully done sometimes early next year.
As a parent, it's quite obvious that not many medicines are prepared for use on children. How come?
Yeah, it's a very good question, and it's one of the reasons why EMA or the EMA has actually developed this program specifically for children. So it's called Pediatric Investigation Plans, and this is the process that we have been through. It's an incentive that has been given because there's far too many drugs and solutions that are not developed or approved for children. So we have statistics saying that up to 70% of the medication given to children in the hospital is actually off-label today. And of course, that's not good enough. And much of it is actually related to that we are not using only new medicine, but we're using a lot of medicine that was developed in the past that doesn't fulfill the requirements that you have today with new medication. So we hope that we can make a difference in this space, and are very eager to not only focus on CT001, but I think in the future it looks good because there are many opportunities for developing solutions that are approved for children.
That sounds great and very important and interesting business-wise. How come you're raising money in these times?
Yeah, well, originally we had set forth that the first capital raise was enough to do the full program. We've had a little delay with basically an ethical committee that didn't approve our application in time. And when you are a little tight on money, we agreed with the board a few months ago that it's better to raise money now, even though the market conditions are not good. And believe me, I'm one of the major shareholders, so it's not good for me either. But we are here for the long term. We don't want to be in a case where we all of a sudden are very low on cash. And sometimes when you do clinical trials, there can be unforeseen delays. We had COVID a few years ago, and that we don't want to be in that situation. So we decided to raise money now, so we so we are not in a situation where we all of a sudden don't have any. So we are prepared for what we call sort of a worst case scenario.
All right, so if I ask you, what is the main reason investors should invest in Cessatech?
Well, first of all, the money we are raising now is to invest in the clinical program and also to make sure that we are progressing as planned with the device and the regulatory requirements to submit a file for CT001. I think investors should consider Cessatech as a company with a lot of long-term opportunities. We do not have any plans to do the commercialization ourselves, so we have started the process where we are looking for partners both in Europe and potentially also in the US. And I think that's our business model. It's very much based on outsource. We are a very flexible organization, but we also have an aspiration that we really want to make a difference and hopefully have more products in the future approved for children. So I encourage all that have a heart for children and believe in our business model to invest in Cessatech.
All right, Jes, thank you so much for answering my questions. Best of luck with the secondary offering and your coming products.
Thank you.